Hi, I'm Dr.Gradishar, Professor of Medicine and Chief of Hematology Oncology at Northwestern University and the Robert H. Lurie Comprehensive Cancer Center in Chicago. In patients with early stage disease, so these are not patients with metastatic disease, but disease perhaps restricted to the breast, maybe a few lymph nodes that are involved, or node negative, where there are no nodes involved. We think of that as early stage breast cancer. In those situations, again, we characterize the tumor to determine whether or not it's hormone sensitive, whether it has this HER2 feature, and we make decisions based on that. One of the key first steps that we take into account is whether a patient requires chemotherapy or not. And typically, we would, in many patients like this, consider a molecular test. And if it proves that a patient does not need chemotherapy, then our typical approach is to use anti-hormonal therapy. The next decision point is really to determine whether or not a patient is pre or postmenopausal. And the reason for that is that there are more limited numbers of anti-hormonal therapy that can be used in premenopausal women without first rendering them postmenopausal. So in that situation where a woman is premenopausal, if you do nothing else, the drug of choice is tamoxifen. Whereas in postmenopausal women, we can use not only tamoxifen, but aromatase inhibitors. Those choices can be also used in premenopausal women, the aromatase inhibitors, but first you have to make a woman postmenopausal. And that can be accomplished either with an oophorectomy, taking the ovaries out, or suppressing the ovaries. And that's another sort of hormonal shot that a woman can receive once a month. And once we demonstrate that she's postmenopausal, then we can use those same drugs that we typically use in a postmenopausal situation. In other words, the aromatase inhibitors.